I'm Dr. John, your host at Voyage Clinics Podcast, and welcome. Our objective is to bring affordable, transparent, beautiful healthcare to our community, and also to bring education to our community as well. Today, we have Paige Moore, one of my favorite people, because I always say that, but she really is. She's awesome. She did a rotation with me a little while back before med school. She's now in her third year of medical school. And I wanted to hear about your journey and maybe just tell us a little bit about your background, your educational process, and then we'll just ping back and forth a few questions.
Okay, sounds great. I grew up in Washington and loved it up there.
What part?
Southwest, so just east of Vancouver.
Okay.
And if you're confused, that's north of Portland, Oregon. So that's the
Portland,
region.
Vancouver. There's like
Well, sometimes people think Canada, so they're always like, No, but grew up there. Grew up a gymnast, and then became a cheerleader when I had to retire from gymnastics. And once I found that, it was the love of my life. And following high school, I came out here to BYU, where I did an undergrad degree in neuroscience. And then followed it up with a master's degree in athletic training.
Oh. And you were a flyer.
Yes. And at the end of my undergrad, I made the BYU cheer team, and I flew for 3 years for the last year of my undergrad, and then both years of my master's program.
Wow.
As a cheerleader for BYU.
That's so cool. Tell me about your journey to medicine. What was it that took you to medical school? You're in your third year right now of osteopathic medical school.
Yep.
Talk to me about that.
Yeah, that is the story for sure. Growing up, I always was fascinated by the body. Having injuries, I injured my shoulder at a young age and was probably the youngest person in physical therapy in that really tiny town that I grew up in. And when I got into high school, I had some concussions from cheering. And by the time I got to the end of high school, I had 5. I had 4 in high school and then 1 as a gymnast a little bit younger. And it made school and life really hard for a really long time. And being a high achieving person and then having this mild, moderate brain injury really was hard to put my finger on what exactly was going on when school started to get in the way of life and life started to get in the way of school. So I got through most of my undergrad. And toward the end of my undergrad, I decided to apply for the Master's in Athletic Training program because the athletic trainers in my life had been the ones that had caught the concussions and helped me recover. And I got into my very first semester, my first clinical rotation, and I was with an athletic trainer at Maple Mountain High School, and she looked at me, and I had not had a day of athletic training classes yet. There's high school summer football, and she asked, "Why are you doing athletic training?" And I had the logical answer of like, well, I had this concussion, this brain injury that I then recovered from. And, this is why I want to be here and make a difference there. And she just looked at me and probably was the first person to see it and be far enough away to know she could tell me without hurting my feelings to say, why are you not becoming a doctor? Why are you not going to medical school? And until that point in life, I had really never thought about it, which sounds silly because now I can't imagine doing anything else. So that was the moment where I distinctly remember having to consider it. And it did take me, a few more months of thinking over things until I recognized that as much as I liked the athletic training in the sports medicine setting, that I wanted to be able to do more and to reach more and expand that the scope of practice. Yes,
totally.
Thank you.
Yeah, your ability to help people. Mm-hmm. So my undergrad was the opposite of BYU at University of Nevada, Las Vegas.
Cool.
And I did athletic training, and it's very similar. I was like, this is pretty cool. I love helping the athletes. I love sports injuries. I love the prevention, the rehab, all the spaces that athletic training kind of teaches you. But I was like, man, I want more. And that was me too. And that's why I moved on to medical school. And I'm going to put a pin in the head injury space because I want to circle back to that.
Yeah.
But I also want to hear about, I don't know, I have 2 daughters there. One of them's on a mission in Rome, and one of them is just graduated high school from Maple Mountain, actually.
Oh, really?
Yeah.
That's awesome.
She plays lacrosse, and
cool.
And she's super nerdy, super brainy, super I'm like, wow, you're incredible. Whatever she does, she can be incredible at it. And she's thinking about med school. And all through, like, I don't know if it's just the area we live in or the BYU culture thing or whatever, but there's a pressure for her not to go to med school from our society. And I don't know, I'm curious if you felt any of that at like BYU, largely LDS Mormon community, and if you felt any of that and how you kind of processed that, or even like gave it the F off card, if you will, like, because you have to just say, look, these are my choices and I get to make choices in life. And that's important for me. That's what my one daughter's really good at that. My other daughter's less good at that. And so it's fine. But tell me about that space, if you will, just a little bit.
Yeah. I feel like growing up, I had fantastic parents, but was raised in a very believing in traditional LDS home. And my parents were they very much were adamant on us getting an education, but they didn't push us anything further than that. And I felt like I went to BYU and I just wasn't pushed to think about anything more. They were like, wow, you want to do a science degree? That's great. And that's where the emphasis stopped. I'm more probably like your other daughter. That's a little bit like hard-headed and like, I'm just going to do whatever I feel like anyway.
Love it.
And so I never really had a ton of pushback from friends or family or from the community, but the undertones are just there in absolutely everything. So while I never really had anybody come out straight to my face and be like, you should not become a physician or go to medical school, the underlying thoughts were more, is it worth the amount of debt that you're going to take out? Is it worth the years? If you want to have kids or when you want to have kids, planning a family just becomes more difficult. And these are all very real and logical barriers that you have to think about. And I mean, they apply to just about anybody. But just the undertones of like, you're not expected to do that, so you don't have to if you don't want to. We're definitely there a lot more. And I think for myself, I came from a family that wanted me to get a good education. And so I knew that they would be supportive in what I chose. And also in my mind, I had already chosen the route of graduate work and athletic training as I was coming into college. And so I was like, well, it's doing a graduate degree, but it's not medical school. And so the burden didn't seem quite there. But it did become a little bit more of a decision I really had to think about and make when I was suddenly partway into a graduate program and realizing I needed to come shadow a doctor and do some more classes and take the MCAT. And that's when I felt more of the pressure to just make a big decision about what my life will look like for about the next decade. And that felt like it was more the location for me. However, I don't think I had anybody silly enough in my life to try to stop me. So
that would be a silly thing for someone to get in your way.
Yeah. just a little bit.
No, that's awesome. I think it's so good to be strong and to be, to move forward in a way that is right for you. And that's what I tell my daughters. I'm like, hey, it's okay. My one daughter's like, yeah, I tell people I'm going into medicine and they ask me if I'm going to be a nurse. And they say, what? Why am I going to be a nurse exactly? So she calls them out like in real
good,
time.
as she should.
It's so funny. She's 17 and she's like a neurosurgeon. Like,
I love it.
So funny.
I love it.
Yeah.
And I think the other part to her credit is it's okay if she does change her mind.
Totally.
There's lots of other
It's okay to be a nurse too.
It's okay to be a nurse. It's okay to be an engineer. It's okay to be a researcher, a PhD. It's okay to flip everything and go into art or music or whatever else that she loves. There's nothing wrong with that. And in fact, I love people that are multifaceted. I love it when I can talk to somebody in medicine about something other than medicine, because we are connected by a lot more than just one thing in one profession.
Yeah.
So
the art at Voyage Clinics, we combine art and science all the time, and the way that we care for people. And I truly think it's medicine 2.0. Like medicine 1.0 was like, here's the science and everything is science. And that's cool. It's very corporatized. It's very dry. It's very, people feel like a number. But when you incorporate some of the real art, I took a dance class at UNLV every semester. I love that. Art. I love singing. Like I have a band. And if you can put right brain, left brain balance into your practice of medicine, it's beautiful. And it just builds, it's just better. It's just way better.
Yeah. You want somebody to understand you from a lot of different areas, because your patients are going to be artists and they're going to be musicians and athletes, and they're not going to be scientists. And while the science is important, undoubtedly, having them feel like they can come to you and that you'll understand their frame of reference and how they view the world and what matters to them will allow you to give them the quality care that makes them feel like more than a number and that you actually care to improve the quality of their life and that you're on the same team as them, which is, I think, vastly true for most of us in medicine. We really are on the same team as our patients. We want them to be healthy and get better and improve. But you're right, it's dry and corporatized, and that makes giving that high quality care really difficult.
Yep. We're going to talk about some of the blind spots in medicine right now. But I want you to first just give my daughters a couple pearls of advice as a female going into medical school, and they're like in maybe contemplation mode of like, pre-med versus something else, what would you give them advice as far as like the sacrifice, like family, like marriage and having babies and, all the things that are like factors that, they factor into the equation. We had 4 kids through med school and residency. My wife is an absolute angel.
Rock star.
I was an absentee father. And as a female, that would have been, I had colleagues in medical school who had babies in med school and babies in residency. And it was super hard. Like those are intense moments of learning and 80-hour plus work weeks, it's just the equation's different. So what advice would you say for any young lady who's considering medical school? What would you tell them?
I think, first of all, see it and see how much you like it. And meaning whether that's shadow a physician or get a really good feel of what that practice will look like at the end, because you have a lot of work in that pre-med through medicine to see where you want to go. For me, that actually happened with you because you were the first doctor that I shadowed.
Oh, really?
I don't know if you knew that.
I didn't know that.
No. When I decided to go, I asked Dr. Fong, I said, hey, I need to shadow a doctor. And she's like, here you go. John's great. So, first of all, being able to see it and make sure that you know actually what you're getting yourself into. Because I had this thought about medicine, and I had really never experienced it besides being a patient. Part 2 being, you do have to enjoy a little bit of the work, a little bit of the science, because years of an undergrad, and whether you do an undergrad degree in a science discipline or not, you still have to take those prerequisite classes. You have to enjoy it a little bit. I think one of the other things, you have to like talking to people. Not always. We make radiologists and pathologists as well.
I mean,
I'm like, you don't have to, but for me, that's one of the most enjoyable parts of medicine. And so those were some of the things that are non-schooling based that kind of come to mind. The other part about, marriage, family, children, your significant other better be like 100% supportive of you, because I would not be alive. I would not be here if it weren't for my husband. I probably would have forgotten to cook dinner or do something else, because I told him, I was like, I think I'm going to go to medical school. And he was like, oh, okay, cool. Like, let's figure it out and work it out. And so being able to have whoever's in your life at that time be really supportive is great. And then I don't have kids. And so I've chosen to, not think about having them right now, which is totally fine. It works for me and my husband, and we're happy for that. I've had friends have them, and having good support and family, and then making sure that you have good communication with your school or your program or wherever you're at, making sure that you're getting all of the support that you need, because you can't expect to have everybody say, I'm not going to have children at this point in time. Like if that's what you need in life, that's what you need in life. And if it's that time for you, then there are ways to do it, and make sure that you get that support and help and encouragement from your school, from your advisors, from your spouse, from your family. But going to medical school, I feel like takes a village. I know it's not raising a child, but it's like this degree that takes you so long to get into, and then to think about all of the years of training. And you don't have to do it alone. And you can rely on the people in your life and utilize them so that you can have the best experience learning possible while still making sure that you're achieving your other goals in life. I don't feel like my life ended when I got to medical school. And I mean, college athletics ended, and that's a different story. And I do miss a little bit of that. But I've found other things to fill my time in my life with, and I love it. I haven't had a horrendous experience in medical school. it's been good. I feel like everybody chalks it up to be this really intense and scary thing.
Yeah.
And it's hard, but it wasn't nearly as bad as I thought it would be when I was 17, when I imagined what going to medical school would be like.
Man, I love it. I have always had a passion for learning, and I grew up in a small town. Like, our limited curriculum, they didn't teach calculus in my high school. Like there was like little things that,
Yep.
I got to undergrad and it was cool. I loved my classes, but in med school is where I really felt like I was really feasting. Like the information, I was like, this is the stuff I want to know.
Yeah.
It was so satisfying from a educational standpoint alone. And I see people like, they're thinking, well, I think a different life choice is this or a different life choice is that. And maybe I'll do a nurse and become a nurse practitioner, or maybe I'll, be a PA or something. And I think the hours of training is something like, 2,000 for nurse practitioners and PAs in general, just clinical hours. And the didactics is like half that, half of medical
right.
school at least. And then there's no residency afterwards. Yeah. And so again, like, I think you're looking at like, the average family doctor is like 16 to 20,000 hours of training. And it is so satisfying. And you can help so many people in so many ways. And so whatever specialty you go into out of medical school, I just think there's so much to it. There's so much training, so much science, and it's so cool and satisfying.
The depth of learning and connection, especially coming from where I did a graduate program in sports medicine. And I loved that. I mean, it's still one of my favorite subjects for sure. But to go and to learn all of the pathophysiology of so many different systems of the body and how they connect and how to be aware of that even when you're just treating an orthopedic injury, they matter. And I'm like you, where I just thoroughly enjoy learning. And I every time I go to start a new rotation and I'm nervous about it, I end it and I'm like, wow, I really loved that. It was so great. And that to me just was another indication that medical school and going to become a physician was the correct choice for me, was because I just wanted more. And I can relate to that. I went to a tiny high school in like a really small town in the middle of the woods.
Okay.
We did have a calculus class, but only one.
Okay.
And there was probably like 12 of us in it every year, so very few. And I mean, going from there to BYU was definitely a big shock, since just the student body population of BYU was like triple that of the entire city that I grew up in.
Yeah, totally.
But you're right. Medical school is definitely the next level, and just the amount of learning, you just don't get it. And it's so focused and so intense. It's just fun, and it's fun to connect all the dots.
Yeah.
Nothing is independent.
Totally. Let's pivot a little bit. I want to hear about maybe some blind spots in medicine. I want to hear about maybe your, as a gymnast and as a flyer, maybe, there was some injuries, I'm sure. And maybe you could share with us a little bit of that journey, and then maybe some things that you noticed as being a patient, like interfacing with the current healthcare system, some of the broken pieces. I mean, one of the objectives of Voyage's clinics is to really fix the healthcare system. It's broken in a bunch of ways, and we're just working hard. I've been working hard for 7+ years to fix it, and from a really quality care standpoint, but also from a cost-effective standpoint, and also from an availability standpoint. And so we've done a pretty good job. It's really fun for me. I love being a doctor at Voyage Clinics. Before I didn't love it as much. It was really hard.
Really?
Stuck on the system that's whips you through more patients per hour, or makes you do certain things, and having administrators bark at you all the time about this and that and the other. And I'm like, I just really want to spend time with people and give them good care. Like, that's what I want to do.
I have a hard time picturing you not enjoying working in medicine, because I've only known you and seen you working in the role that you're at now with Voyage. And that just I can't even picture it, because you're always so happy to give care and excited to teach. And I have I think I only shadowed you for like 40 hours. It was whatever the minimum was, because I was trying to take the MCAT and everything else. And I remember having the best time with you. I was like, oh my gosh, he just is so happy to be there and giving this quality care. So I always, I'm glad you found what is your calling and where your role is. Yeah. But some blind spots in medicine. Yeah. I started having shoulder issues when I was about 9. And for me, one of the hardest parts of the care that I got growing up was that as a gymnast, I was really strong and really flexible. And so I'd come in and say that I was in pain, and they wouldn't necessarily believe me. They'd be like, well, you're strong and you have good range of motion. And that's kind of where it ended. And not to discredit my parents, they didn't know, but I don't think they understood how much pain I was in when it's been 18 plus years and I still struggle with some of the same injuries that I did back then. And just having something really difficult about going to a physician and saying, hey, I'm in a lot of pain. And they do an evaluation and they look at you and they say, you're totally fine. And that was really hard. Like, that was really, really hard to have an MD that's a sports med, like, look at me and say, yeah, you're totally fine. And to know that I was like, I'm not crazy. I'm like, I'm not making this up. I'm a high performing athlete. I was like, I'm still going to go do everything. Like, that is the kind of person I am. I'll be like, I'm in pain, but I've been in pain for so long. What's the big deal? As I got older and I just realized that, I had had physical therapy and MRIs and things, and we eventually would chase a few things down. But between some of the orthopedic injuries and the concussions that I know we'll get to in a little bit, it was really hard to have doctors constantly looking at me as a generally healthy appearing person and just discredit so much pain. Now, on the flip side, once I, found some good DOs, I had people evaluate me and say, oh my gosh, you have a lot of things that we can work on and that we can treat, in somatic dysfunction and hypermobility disorder that I didn't know I had. And it was hard because 15, 18 years ago when I was a kid, I don't know how much people talked about some of these things. Hypermobility made me really flexible. It made me a great gymnast, but the instability caused so many injuries. So I've had more ankle sprains than anybody can count, and too much trauma to the shoulders and the spine than I like to admit. But when I finally found somebody that could talk me through, hey, this is probably what's going on with your body, and to know that we could do something about it was shocking after I'd been told for so long. So to that credit, I mean, part of that's research and development and understanding how to work with some of these disorders or injuries that aren't as obvious. But second of all, making sure that you're not diminishing your patients, especially your females, that sometimes get swept aside. Women's pain gets pushed aside more often than it should.
Let me speak to that space just a little bit. I see this quite a bit, and I have learned over the years to really hear people. You have to understand them, and you have to talk to them. Like when someone comes in, I just had a new patient come in today, and I said, well, who is this person? Where are you from? Tell me about you. And they tell me about their background, and they give me this story, and they're really giving me a nice tapestry for me to understand who they are. And if somebody understands that you're a gymnast, A, so that means you like to suffer, and B, and you're probably pretty flexible, that means that you're used to working through pain, which means physical exam is not going to be the same for this gymnast person than it would be for another person. So this other person who has, frozen shoulder or whatever, labral tear, they might give you the classic milieu of symptoms, but the gymnast won't, because she'll be like, right? She's going to go through the range of motion.
Right.
And so I think knowing who your patients really are and building that relationship and understanding them. I have some patients who one patient, I sent her to the ER. I was like, listen, you've got something very, very serious going on right now, and you need to go to the hospital right now. So she says, okay. And I said, but listen, when you go to the hospital, I need you to tell them in no uncertain terms that you are in 10 out of 10 pain, and you need to repeat it like a lot, and put on some drama for me, please. Because she is so stoic. She can be in 10 out of 10 pain and you won't see it. You won't see it, but only because I know her so well was I able to advise her on how to kind of interface with this system, who will just look at her. The doc will look at her for 2 seconds, push on her tummy and say, no, you're not in this much pain. But because I know her, I know she's in that much pain, I can help her. And then I'll call the ER doc and say, listen, She's very stoic. Her pain threshold is very high. She's not going to be a typical presentation to you.
Right.
And then that way it gives the ER doc kind of some guidance on, okay, this is going to be a real case.
Right. And that's how I feel like medicine should, I feel like that should be the standard, right? But when you're only allowed a few minutes with patients and it's so, okay, if we don't get to the point and insurance and billing and all of the other hoops and right, all of the things you were talking about that made your life miserable before you were doing Voyage, those are actually barriers to care. They don't promote good quality care, and they don't promote the health of your patients, which is like backward.
Yeah.
Because when you can do that, then you can look at somebody and understand and get to know them and have the opportunity to see where they're coming from and see them at baseline and then see them when something changes and be able to figure out those nuances that sometimes take people months or years or many visits or specialists or time and heartache and distrust in the medical system, when really they needed somebody to have a better idea of who they are and how to pull out the information that is important to them and to us as caregivers.
That's it. It creates huge blind spots in healthcare. And I don't know that it's intentional. I think that the incentives around the way that healthcare works with interfacing with insurance companies and these big ACOs and these big companies that tell us how to be doctors and what to do and when and why, it creates perverse incentives that are really challenging for doctors to be their best selves. I don't believe there are bad. I mean, there are probably a few, but like most of the time, doctors go into it like you and me. There's like want to help people, want to be good people, and want to take good care of people, and then they're plugged into a system that is just hard to do that on. And so that's why I stepped off and did Voyage clinics. It's been awesome. But I give kudos to the docs who are on the system, like I was, trying to be the best doc they can to these people, but just the constraints of the system, sometimes limit that. And then you have frustrating situations like yours where I'm sure that sports medicine doc was a good person. Like, really great, like
totally.
Just missed it, because he was like, I'm sorry, like I only have 15 minutes with you.
Right.
We've already spent 5. And so.
Right. Yeah. And the pieces don't click for them.
Right.
And treating gymnasts and dancers and cheerleaders looks really different than treating football players that come in with shoulder pain. And I can acknowledge that. And I also acknowledge that even with a 1-year sports medicine fellowship following family practice, you can't cover everything. You don't get to see everything, and everybody presents differently. So with the lack of time and the lack of that resource to get to know your patients, you're going to give suboptimal care.
Totally. There's another blind spot in medicine around concussions and head trauma. I think, I don't know that it's deliberate. I think, again, I don't think a lot of the things in medicine are not so deliberate. There's dogma, and then there's like constraints on the current healthcare system. But concussions are interesting. You may have a concussion in a sport or in a car accident or whatever. You go to the ER, and the ER's job is really to make sure you're not going to die. So they're doing CT scans, no brain bleed. Okay, they're doing neck scans, no fractures, and they're looking you over, making sure you're not going to bleed out or die from a brain bleed or something. Once that's ruled out, they don't always pull down that diagnosis of concussion. They're just like, well, you had a whiplash injury and send you home. And then afterwards, it's true that a lot of people normally just recover after head trauma. Like I grew up in a small town, didn't even have a doc there. And we played 8-man football. It was a smash mouth. We just ran the ball all the time. And I was halfback, and then I was middle linebacker, and then I was special teams. So I was always throwing my body at people. And I probably had a concussion every game, at least one. And most of the time you just recover, right? You're fine. I performed well in school. I did all the things. And then in college, I played rugby, which was also a dumb choice. And again, multiple concussions. But I just, I was the typical poster child for concussions. You just plug yourself back into society. You go to school, you do work, you do all the workouts, you do all the things, and you do fine. But there's a percentage who don't do that.
Yes.
And that's where I want to talk about a pretty big blind spot in both the diagnosis of concussions, but also in the treatment of them. Let's talk about it.
Yeah. Let me give you the kind of the layout of my concussion story. I know I mentioned a little bit earlier, but had one concussion when I was about 9 as a gymnast. somebody tumbled into me and I got like momentarily lost consciousness. And then while I was cheering in high school, I got dropped and I had 4 concussions within about a 2-year span. When I was here at BYU, I then had another one while I was coaching gymnastics, and then I was in a car accident. So I had 7. That's my grand total. We're going to keep it at that, let's hope.
Yeah.
But a lot of them, like you said, the one when I was 9, I don't remember having any issues with it. I got hit in the back of the head. I had a headache for a couple days, back to school, totally fine. The next one in high school, you took a couple weeks to bounce back, but I had a little bit of trouble in school. I had a math teacher pull me aside and be like, this is not you. Like you're missing things that you were doing well before your injury. And that was the perk of going to a small school. Everybody knew me, like everybody knew each other. And so everybody kind of knew what was going on.
It's like having a good doc.
Yeah. Yeah. Right.
They know.
They knew. And so, then what was it, that next one? I had another one, I think toward the start of my junior year of high school. And I'm missing like large chunks of my memory in my junior year of high school. And that was the one that really took me out for a long time. I think it was that year that I never went to the ER with any of them. I was functional enough after that I was watched actually carefully by my high school athletic trainer. I give her very good credit for keeping an eye on me. She finally did refer me to a physician to make sure that I was on track. And, similar thing, nothing is appearing to be out of place. You can walk and talk and you're having a conversation with me and I'm sorry that you're symptomatic, but I don't know what to do with you. And so I ended up doing a lot of like multidisciplinary rehab with my athletic trainer at the high school because she was the only person that was like, hey, I know you and you're not getting better. Once I got out of high school, I had a couple more toward the end or my senior year. Once I got out of high school, I was nervous because I knew that my brain didn't work the same coming to college. And I just didn't feel like I had support because despite my brain not working well, I was valedictorian of my high school. I was at a small school. It was not like going to Maple Mountain or Lone Peak or something like that. And so it was hard to function still pretty well, but I knew that things were not the same as what they had been. Then you have the conundrum of you have so much development happening between those teenage years that how do you keep track of what would have been versus what could have been when you're trying to throw all of these things in the mix? My last couple concussions that happened while I was here in Utah, just a few months apart, that's when I started to have some pretty decently severe symptoms, like some memory issues going on. I was throwing up every day. I had serious issues with my vision. I had balance problems, and I would go and I went one time and saw like a family practice doc, and I was like, I have so much abdominal pain and I'm throwing up, and they're looking at my gallbladder and taking out my gallbladder. And I didn't even know for sure whether it was coming from the concussion or the car accident where the seatbelt had been. Like I didn't know as a 19-year-old. And so I didn't know to bring up the fact that these all could have been stacking on top of each other, which sounds silly now that I talk about it and now that I've been working with these type of problems for so long. But I was so convinced that nobody knew what to do with me that's why I wanted to do a degree in neuroscience before I went into athletic training. That was my goal, was because I was like, well, if nobody can tell me about my brain, I might as well learn about it. Because I truly felt like I'd hit a dead end. And they're like, well, you're just going to have headaches and need to sleep all the time for the rest of your life, which was another reason why I hadn't even considered medicine. I'm like, I can't even get through undergrad.
This is so wild. So after like any injury to any part of your body, right, there's a process of healing and then rehab and strengthening, and then you're good.
Right.
And with our brain, arguably the most valuable organ, we don't necessarily have resources there. We do, but they're like off the beaten paths.
Right.
So your average family doc or sports medicine doc may not know about those resources, that there are people doing rehabilitation for brains post-concussion who have that exact milieu of symptoms. The ones that you just described are like post-concussion symptoms to the T. They're like exactly right out of the textbook. Unfortunately, they don't teach that very much. And so a lot of the docs, even the neurologists, they're like, well, you didn't get better from your concussion. That's weird. So they're not talking about post-concussion syndrome, but having like those innovative clinics like Cognitive FX, NeuroFX, some of these ophthalmologists are doing their rehab there, and you were having like visual
Yeah.
issues, balance issues, like classic brain stuff. And did you get the help that you needed?
Yes.
Did you?
Yes.
You rehabbed
So
it. Yeah.
the thing that actually tipped it off is I was doing some extensive GI workup with a great gastroenterologist. He was an awesome doctor, just the wrong specialty. And finally he was like, "Well, are you having migraines? Like coming through like abdominally?" Like he was talking to me about that. And I was like, "I don't know. I've had like 7 concussions." And he, like, his face at that point was like, "Yeah, that could be it." But I don't know if he had the right kind of recommendation for me. But what actually happened was my husband, he's a mechanical engineer, but while we were in college and when we had just met, we were just barely dating. He's also a videographer, and he had gotten hired to film somebody's recovery at Cognitive Effects because he knew somebody in their marketing department at the time. This was 2017.
Yeah.
And so we had barely just started dating. I think they had even contracted with him before I met him. And he's like, "Yeah, I have to do this thing this week where I have to show up every day and follow this person around, and they have a brain injury and they're going to get better from it." And I was like, "Wait, what? Like what?" Like I was so lost. And at that point, I still wasn't convinced that I had a full-on brain injury. I just thought I was still kind of like maybe struggling a little bit. Yeah. Anyway, through an introduction, I was able to start doing some shadowing and some learning, and they ended up needing some help that I could, do as an undergrad student. Just with some research and some tech positions. And while I was there, I was commenting how fascinating it had been and how I'd had some injuries. And so this is so cool to see these people that were so ill getting better. And Dr. Mark Allen overheard or heard from somebody that I was there in the clinic and had some injuries. And he came up and found me right away and was like, "You're getting treatment. Like, I can't have you treating my patients and have you be suffering at the same time." And he's like, "You're getting in the scanner. We're doing your functional MRIs. We're doing structural, making sure everything's good. And you're going to get a week of treatment, like, as soon as we can, because you have a brain injury." Like, I was like working. He like pulled me out of like appointments with patients. It's like, "You need to get better. You have an injury." And it was odd that I had to be convinced of it, but it was one of those like pride things. I was like, no. I was like, "I can get better myself. I can handle this."
Oh yeah.
And looking back, I'm like, I'd been told for so long that there was nothing wrong, that was more of the underlying tone, as I was like, well, I've been told so many
And
times
you were
I'm
being
okay.
told that, right?
Right.
Totally.
So have somebody sit down and say, "No, you actually have something that we can work on and we can fix." And I went through their week-long treatment. And when I say that my life has been completely changed because of it, it's not an exaggeration. I went from throwing up every day and failing my classes at BYU to getting straight A's. I went from not being able to walk and having to like hold onto the wall to a Division I cheerleader for BYU, being thrown in the air and balancing perfectly and flipping and tumbling and doing everything else that I had always dreamed about doing and hadn't been able to do. And not only that, but following that, the realization that I wanted to continue to help people in lots of different ways, but specifically this one, because it sucks to be in a position where people look at you and say, "Well, you look fine," but you don't feel fine and you're actually not fine. And that was getting through that treatment is the reason that I feel like I'm able to even make it through medical school and become a doctor. Because if you had told me I had to sit for 7-hour MCAT and board exams and everything else, I would have been like, "Oh no, I will never be able to handle that."
That is so cool. What a cool journey. And yeah, just amazing that you were able to come out of that. Even with the blind spots in medicine around concussion and post-concussion syndrome, you were just kind of led. It's funny, mechanical engineers, it was serendipitous the way it happened, but like, it's cool that, he kind of figured some stuff out for you and helped you with that. No, that's really awesome. And it's neat that all of your symptoms kind of melted away. And I think that if there's a point that we can make to our listeners today, like if you have had a concussion or brain injuries and you're not getting better, there is hope. It's so frustrating to like be told by multiple physicians or multiple healthcare providers that there's nothing we can do. Sorry, you just didn't get better like 90% of people do after concussions.
Yes. Yeah.
But there are innovative places out there that are doing some neat stuff to try to help these folks. Neurocognitive rehab
yeah.
is wonderful. And I feel like we should integrate that more into our healthcare system somehow. Like,
Absolutely.
I only know of a few places around that are doing that kind of work, and we need it. We need it like physical therapy. We just need neurocognitive therapy, like post-concussion. Or maybe they should train PTs how to do it. I don't know, but something needs to change.
Yeah, something. Or even if it's just, I mean, you're right, 90% of patients do just spontaneously get better. Look at you. It was great. Perfect. You're like the poster child for that, and I'm the poster child for the opposite. They're like, so this is when everything like doesn't get better, and this is when everything does. But imagine if any time we had somebody with a concussion, they had a follow-up with a PT or with somebody that was trained in that to say, hey, yeah, we definitely need to refer you for more extensive training, or to just keep that rather than, you get discharged from the emergency room and you have no one else. Fortunately, I did have athletic trainers being an athlete, and I had somebody to kind of keep an eye out for me in that sense. But then I feel like it's been, part of that life mission is to let people know that you can get better from it, you can improve from it, and there are ways to do it. And some of them are off the beaten path, but hopefully they're starting to become less off the beaten path and more available, so that way people can access the resources they need to get that. And hopefully our education for our primary care physicians is getting better so that they recognize it, even if they're not confident or comfortable treating it, but giving them more of the clues about what these patients are going to come in and say. And then again, if you know their clinical if you know their life and their background, you'll be able to see those differences. And then connecting them with those kind of resources, whether that's physical therapy or cognitive therapy, speech language, vestibular, occupational, visual, like there's so many different routes it can take. And that's not even to say that everybody needs all of them, but knowing that there's more resources besides go home and do nothing, which used to be the recommendation and is no longer the recommendation at all whatsoever. Even in, medical care, even in my medical training in medical school, we're not taught that, which is great. But why are we not treating this like an ACL tear?
Right.
If you were to do that same mechanism of treatment or mode of treatment for an ACL tear, you wouldn't play sports again, right?
Right.
You need the intervention, you need the rehab, you need the return to play, you need the strategic, specific loading and preparation to get back to what you were doing. And you cannot expect that the brain is just going to magically do that if you go sit in a dark room.
Right, right. So good. And what a cool journey. And I think just to shed some light on that space of concussions and post-concussion syndrome, when folks don't get better, what to do is really great. I want to pivot a little bit to osteopathy. So, so I'm a doctor of osteopathy. I'm a family physician, board certified as well. And, there's MD and there's DO, tracks towards medicine. And I want to hear about, why you chose osteopathy and what's that, what is it that drove you that direction? You're in your third year of osteopathic medical school.
It goes back to part of my concussion injury. The doc, I didn't realize it at the time, but the doc that I was referred to in high school to kind of follow up with some of my concussions, even though he didn't know exactly what to do for me, he was a fantastic physician. And he was a DO, and he's the first DO that I remember seeing. And he was the first doctor to sit and look me in the eye and ask me how I was actually doing. And that stayed with me. Again, he didn't have a good answer for how to get me like all the way better from these concussions, but he was so kind and attentive as a physician that I was so impressed. And that was before I even knew about any of the hands-on osteopathic skills. But from that day on, I sought out DOs. Simply because I liked the care that they gave me. And then when I did my master's program in athletic training, I had an amazing preceptor for 2 semesters that she had taken extensive additional courses in myofascial release and fascial work and muscle energy. And I had incredible like one-on-one training with her on how to utilize the body in a way that most athletic trainers don't get quite that deep in their training, especially as a student. And I fell in love with being able to heal with my hands and the way that I could decrease people's pain with just a few minutes and a few techniques when you're right, their range of motion was normal and their clinical exam was normal and there's not a, ligament tear and things like that, but they are in pain. especially chronic pain. And it was with dance and performance medicine at BYU. So again, I was working with these athletes that are hypermobile and happy to be in pain, because let me tell you, ballerinas will handle pain like a champ.
Yeah.
And that was during the time when I was deciding to go to medical school. And I knew that it would feel disingenuous to become an MD for me, because I wanted to continue furthering that skill of using my hands as part of my healing. And then I've already been through cognitive effects, where I've had some of this off the beaten path treatment and seen the benefit of having a more holistic and comprehensive care and plan for healing. And not that MDs don't give great holistic care. They do. This is not to bag on MDs. They're fantastic. But everything worked out, and I was accepted to schools that worked for, where I was at in my life, and my husband's graduate work as well. And it was kind of the perfect setup to not have to change a whole bunch of things and to be able to pursue the degree that I wanted.
That's so cool. I think the art of touch is really part of the art of medicine. And sometimes, I remember going with some preceptors that I trained in a dual accredited residency program, so MD and DO.
Oh, okay, cool.
And some of them would not even touch the patient at all, like zero touching, just looking at labs, looking at science, looking at the medicines, looking at, the images and all the science, right? And that's cool. But I think everything in healthcare is biopsychosocial, and there's art in that, and there's touch in that, and there's feel in that. And to just add that skill set into the caring of families, like I was a rural doc in Moab for 6 years and delivering babies and doing ER and hospital and C-sections and all kinds of, all the things. And I've always been able to do osteopathy. So like adjustments here and there were needed, and myofascial releases and counter strains and all kinds of, craniosacral stuff. And I think it just enhances the trust, the connection, the art of medicine. It's really lovely.
And to your point, some of these techniques and things they're not that complicated in the administration of them. Mm-hmm. They don't take impossible amounts of time. And even if they're just help assisting, they're just adjacent to your medical therapy, right? You likely will still need whatever medical or surgical or intervention that we're talking about. But if I can help you feel more relaxed, if I can decrease a little bit of your pain, or just the fact that touch is therapeutic. People like to get massages, and people enjoy that. We enjoy touch and connection. And to have somebody come up and know that your physician's evaluating your body and trying to help you heal your body is kind of, feels very cold to have them not come up and do any kind of physical exam or get any kind of information through touch.
When I was a resident, I remember that there was a study that came out that showed that physicians who touch their patients more have better outcomes. And it's such a no-brainer, but there is energy there. There's mojo there, and it's magic, and it's neat. And whether you, I think there's science there too in osteopathy with the counter strain and the techniques, but they weren't even talking about osteopathy. They were just talking about let me just touch your arm and listen to you with the stethoscope. Like that much touch. They weren't even talking about the osteopathic piece. So I just think it's neat. And people come to their physician for a very unique relationship. There's so much trust and vulnerability, and it is a sacred space. It is so special. And to just add anything there that can create more connection and more healing is lovely. It's so lovely.
Yeah. And it just feels more comprehensive, because as a patient that doesn't have the same medical education that the doctor does, they can come in and they can tell you the symptoms, but what other information can you get from, even just like you said, not even osteopathy, but a physical exam? Can you catch something that you would have otherwise missed? The person that comes in for a wellness visit that has a suspicious lymph node, like those things happen, right? How can you put something that is going to improve your outcomes and improve your relationship with your patients and kind of forget that that's kind of the whole point?
in closing, I have a fun story. So I just saw this young gal today. She's like 20 and she's a dancer. And of course, right? So you can't trust anything they say. They're just going to not show you pain. So she tells me this story about this flank pain that she's had for a long time, and she knows it's her kidney. She's been to multiple doctors, and they did an MRI, and they found, sure enough, a cyst on her kidney. And in med school, I don't know if you've learned this yet, but like kidneys have cysts, like benign, super normal, very simple cysts, like probably 60% of our population, if you did MRIs on them, they would have cysts on their kidneys. So it's not the culprit of pain, but they went down this rabbit hole of it's got to be your kidney, right? And so I'm listening to their story, and I'm spending an hour with them and hearing and doing an exam, and then during our exam, I'm just feeling like where she's having the pain, and it's right on her external oblique, and she has a band of like striated like myofascial tissue there. And on the other side, I push, and it's like there's nothing. So I'm showing her, I'm like, hey, feel this, like there's nothing here, but on this side, she's like, oh, that's the pain. And I'm like, okay, so like this is not internal, this is external, and it's musculoskeletal. And so we probably need to do some work with this space to kind of heal this thing. It's not all the time that this happens, just when it exacerbates or whatever. And then I want you to look at your biomechanics of your dancing, because she's like a high-level ballroom dancer. And I'm like, well, think about when you engage that space and when it hurts. And if there's a lift or something that is right on that side, let's talk about mechanics, and let's let you help me kind of bird dog this situation here. And so we got a cool plan, and then we did, an adjustment and things. And so it's just, she's all the way down this like multi-$1,000 workup on this cyst on her, and there's a possibility that they're not sure, but there's a possibility that there might be something wrong with her kidney and XYZ. And so like, I'm like, we have to finish that workup. So we have to continue down the path until it's ruled out completely. And the radiologist was hedging or just saying like, I'm not sure if it's this, it could be that. And so now we have to go to another specialist to, get their opinion. And anyway, it just makes it really tough, but I think it's neat. It shows like just the art of touch, and that we can help people with our hands and find things that, maybe other folks might be missed a little bit because they don't palpate as much. They don't use their hands as much in medicine. Yeah.
It's just another tool, and use it, learn to use it.
Totally. Paige, thank you so much. This has been so fun.
Thank you so much for having me.
It's been fun to just highlight a few things. Is there anything else in closing? I mean, we've gone over some cool ground today.
It's never too late to change your mind.
Yeah.
If you feel like you're it's not too late. If you're wanting to go into medicine and you're not 17 like your daughter, or you're not in your early 20s, you can still make that change, and there's room in medicine for anybody that wants to be there and wants to give that quality care. So if it's something you've been thinking about and you just feel like this was the push that you needed to do it, it's not too late, and we're always happy to have you.
Let's go, Paige. That's awesome. Thank you. Guys, don't forget to like and subscribe, Voyage Clinics. And thanks, Paige. You're awesome.